Hi, I'm Dr. Jan Jaffer, and this is Got Teeth, a patient-centric monthly podcast featuring local health experts. Sleep plays a crucial role in our overall wellness, impacting everything from our mood and our cognitive function to our physical health. Today, we have the privilege of speaking with Dr. Sachin Pendharkar, an associate professor at the Cumming School of Medicine and the medical director of the Foothills Medical Sleep Center. Hi, Sachin. How are you doing today?
I'm good, Jan. How are you?
Great. So today we're going to talk a little bit about sleep. I know something that you deal with on a regular basis in your practice. I mean, you're helping people around Calgary all the time in how to understand sleep, how to sleep better, and to know when there's problems. So I thought we'd start with just a basic question. What does good sleep look like, or what are we looking at when we're talking to people about sleep?
Sure. I mean, I think it's a great place to start. So when we think about sleep, we really have to break it down a little bit and think about the quantity of sleep. So how much is somebody getting, but also the quality of sleep. How good is the sleep they're getting? So definitely there are people that get lots of time in bed. They're sleeping for some of that time, but it's not very good. And then there's people that get a full, what seems like a full night of sleep, but again, the quality of it isn't very good, so they don't wake up feeling very good at the end of it all.
So when you talk about that, because I think that's a really interesting one, because some people will say, "Hey, I sleep 8 hours a night, but I wake up and I need 6 cups of coffee to get through the day," and you're like, "Well, that doesn't seem to make sense. You got your 7 or 8 hours of sleep, so you're now talking about quality of sleep when something like that is happening."
Yeah, exactly. And I should say that, when we talk about 7 or 8 hours of sleep, that's kind of the recommended time that most guidelines, public health, information will provide. But we know there's a range that's probably a little broader than that. So some people can get by with a little bit less, 6 hours, for example. We know that some people need more than 7 or 8. So the first thing I ask people as well, if you've got 7 or 8 hours and you're still feeling sleepy, what happens when you get a little more? Because sometimes you might just be on that end of the curve where you need a little more than 7 or 8 hours, maybe nine, sometimes even up to 10. Beyond that, we start to wonder, maybe there's something else going on. But if somebody is getting 7 or 8 hours of sleep, and that's been good for them in the past, and now it's not anymore, they're having difficulty, that's when we start to wonder whether there's something else going on. And you're right, that's when we say, okay, maybe it's not the amount of sleep you're getting, but what's actually happening during the night. So the quality of that sleep.
So if somebody does say that, and you're talking to somebody and they say, "Yeah, I used to get enough sleep. I still get the same amount of sleep, but I feel like I'm foggy. I'm exhausted every single day." How do we know what a good quality sleep, or how do we know that we are getting a good quality or not good quality sleep? Is there something that we can tell without, obviously going into a doctor first to say I'm not sleeping well? Is there any things that we can figure out on our own?
Yeah, sure. So I think the first thing that you said is really important, which is just figuring out how you feel after what seems like a good night of sleep, right? We expect that after a, 7, 8, 9, whatever the number of hours is that works for us, we expect to wake up, you know, ideally without an alarm, although I don't think that's the case for most people, feeling refreshed, feeling rested, ready to take on whatever the day brings, right? Sometimes we need a cup of coffee, fair enough, but we can get going. That's actually, if we think about the way that our sort of sleep and wake cycles work, that first few hours after you wake up is like the time when you should be the most awake. And so if you're having a hard time, getting going, once you get going, if you just can't get going, or you get the day started and by, 10, 11 in the morning, you're falling, finding yourself sleepy again, that's a really good sign that something's not right with the sleep that you're getting. So now we've kind of figured out that that's not working well. Now we go back to sort of what's happening at night. It can be really hard. In the clinic, I often sort of joke with patients that they might not be the most important person in the room when it comes to taking a history. It's actually the person that sleeps next to them or in the house that can tell them what's going on. Because when we're sleeping, we don't actually know what's happening. So, if we can be sure that we're getting the right amount of sleep, that's a good start. If there's other clues from people that are in the house or in the bed that can tell us, hey, you know what? You were really restless, you were stopping breathing, you were kicking your legs a lot, whatever the problem is. That's when we can get that information that's useful for us to say that, hey, maybe the quality isn't as good. The other thing that sometimes happens is people go to sleep, they fall asleep, and then they're having multiple wakenings from sleep. We call them
Mm.
arousals from sleep. So, the total time might be adequate, but what's actually happening during the night and what we experience might actually be different. And those are again other clues that tell us that maybe the sleep hasn't been as good quality as we might have thought.
Okay. No, that's good. So before we get into how to maybe get better quality sleep or things that we can do, any thoughts on, these new watches that we have, these apps on our phone, like, are those actually helping us figure out that we have a problem? Again, not solving our problem, but is there some benefit in, wearing, I have, this Google Watch, and I sometimes I sleep with it, sometimes I don't. Is there any advantage in tracking sleep that way for us to see, or do you find these are a little gimmicky in terms of being able to tell us anything?
Yeah, it's an interesting question. It's something that comes up a lot and more, right? People have devices. I mean, I wear an Apple Watch. I don't wear it to bed. It's an alarm clock on the bedside table for me, but um, you know, the technology is advancing very quickly. And one of the things I'll say is that a lot of the real sort of fast advancements are happening on the commercial side. So they're sort of black box proprietary algorithms. And so it becomes a bit hard to know what exactly are we looking at. We get this nice fancy printout or screenshot from an app, and we say, okay, well, it says that I'm getting this much of this type of sleep, et cetera. But it's actually pretty hard to know how is it determining that, and what are the inputs going into that determination. Um, the studies, so we actually have a medical device that we use. It's called actigraphy. It's a similar device. It's a watch that we use that helps us to estimate sleep in a similar way. And I know a little bit more about that because it's a device that we use in clinical practice. Picks up how much light is coming in, picks up movement. Some of them can pick up heart rate changes. Those are probably the kinds of things in these commercial devices. But what we know is that the commercial devices aren't too far off of what an actigraphy device provides in terms of estimating sleep and wake. I'll be honest, when we get into like sleep stages and that, I'm a little bit suspicious because I don't really know what's in the box. So that's always a bit challenging. So it can be a guide, but the other side of this is particularly when people have difficulty falling asleep or staying asleep, we can sometimes get really fixated on the data. And then we
Yeah.
start looking at the watch and reading the reports and starting to kind of activate ourselves around sleep. And that can translate into, well, now I'm going to sleep. What's my watch going to tell me? And then we start to sort of, activate ourselves around just the notion of falling asleep, which should be relaxing and restful, but it ends up being quite the opposite.
Okay. No, that's interesting. So yeah, so maybe the sleep and awake is okay with that. And again, trying to stay out of your head, which would kind of take us to the next part. So if we want to have good quality sleep, and I think everybody does, are there things that we can do at home before bed, during the day, that will help us get a better night's sleep, without, again, starting to, worry too much about ourselves? Like, what are the things that we can do ourselves to try to make our quality of sleep better?
Sure. So I mentioned earlier that there are some sort of natural processes that sort of, timings for us to be awake and asleep. And so just very quickly to go over those, the one big driver of, when we sleep or how sleepy we are is how long it's been since the last time we slept. So the longer you stay awake, the sleepier you are. That's sort of a given. So you wake up at a set time every morning. After a certain number of hours, you're going to have this, what we call sleep pressure, or sleep drive that wants us to go to sleep, forces us to go to sleep. But there's a second sort of, what we call the circadian rhythm or day-night rhythm that also influences a lot of things in the body, but among those, when we're asleep, when we feel sleepy and when we feel like being awake. And those sort of, the circadian rhythm and our sleep pressure tend to kind of align around our usual bedtime and then align to sort of wake us up around our usual wake time. So I mean, we don't have to measure those things, but people generally have an idea of like, here's when I'm sleepy around this time. Here's approximately how much sleep I need. Therefore, here's around the time I wake up. I think sticking to a routine is really important, or sticking to a regular bedtime and wake time is really important, especially for people that feel like they're not getting enough rest, or enough sleep. They don't feel rested in the morning. Making sure that we sort of think back to like, what's a good bedtime, what's a good wake time for my life and for my sleep, and wakefulness sort of patterns. I think that's a really key one. In terms of the nighttime routine, there's sort of do's and don'ts. The big things are trying to sort of settle yourself into sleep, right? So things that trying to avoid things that are too activating. So caffeine is a big one that sometimes people take late at night. Exercise is really good for us, but really intense exercise before you go to bed can activate you and wake you up. I think a lot of people have probably experienced that when you have a late workout. Light exposure. So devices, smartphones, we're all on our devices late at night. Those sorts of things can actually be very activating, and they actually send signals. The light sends signals in through the eyes to sort of tell the brain it's time to wake up, which is the opposite of what we want to happen around that time. And then the other thing is if people find, watching the news stressful or certain TV shows very activating, trying to just manage when those things occur in the course of that evening so that you don't hit the bed thinking about too many things activated, because those are the kinds of things that'll get in the way of having, a restful sleep. And then I guess the last thing is just things we put into our body, right? So, caffeine, I mentioned, alcohol is something that sometimes people use to help fall asleep, but it actually disrupts a lot of your sleep later on. So it might help you get to sleep, but probably doesn't do you a lot of good through the night. And heavy meals, believe it or not, they can actually sort of, although they make us feel a bit sleepy, they probably don't do us a lot of good in terms of the quality of the sleep that we do get. So those are the kinds of things that we can definitely think about to be able to get to sleep at a reliable time and have as good a quality sleep as possible.
Okay. No, and that's really good. I mean, again, it's trying to do the stuff that we can at home, first to try to get ourselves better quality of sleep. And then if it
Absolutely.
doesn't work, obviously, there are things that don't go right for people, right? I mean, this level of, and I don't want to get maybe too far into it, but sleep apnea is a problem that we're seeing, and it seems like a problem that's growing, or we're able to see more. I'm not necessarily sure which of those, but it seems like a bigger problem that people are talking about a little bit more. And so I'm trying to figure out, without, taking a ton of your time to figure this out, like,
Yeah.
what happens when we're not sleeping well? What are our options, if we're just exhausted every day, if we're trying to put the phone away, we're mitigating our alcohol, our caffeine, and we still just can't get a good quality of sleep. Maybe what's some of the problems, or what can we do at that point in time? Because sometimes we need some medical intervention to help us get better.
Sure. Yeah. So I think you started off, the right way, which is that, like, let's just take stock of what we're actually doing, right? So let's assume that all those, sort of behavioral things, the things that we can control outside of outside of going to seek help, making sure we're getting enough sleep, we're avoiding all the things that contribute to poor sleep. Now we're getting our 7, 8, 9 hours, still feeling like we're not getting the restful sleep we need. That's probably a good place to start thinking about seeking help. Typically, I recommend people talk to their doctor at that point. There's many things, sleep apnea, I mentioned, there's many things that can lead to poor quality sleep, that probably, you could sort through with some sort of, inquiry. Once we've kind of ruled out some of those things, medications, medical problems, and start thinking about primary sleep disorders, sleep apnea being a big one, then we can start to move into thinking about testing, right? And so, there are different types of tests, sleep tests. One is a sort of very sophisticated, complex test in a sleep laboratory. That's kind of the gold standard. But the test that's quite a little more commonly available is a sort of a home-based test that essentially focuses on breathing during sleep. And that would be a test that could be used to diagnose somebody with obstructive sleep apnea, assuming they have, the symptoms and perhaps other risk factors that suggest that sleep apnea is likely to be the problem. But that would be the kind of scenario where you'd want to go to your doctor, start asking the questions about, sleep, and, sort of sharing those things. I think people often undervalue their sleep, and as a result, they sort of undervalue the importance of talking about their sleep when it's not going well. And so I just sort of encourage people to really take stock of, like, I'm feeling pretty tired. If I'm getting good sleep, then what else could be going on? And that's when you start having those conversations.
No, that's great, because I think the fundamentals start with, I mean, if we don't sleep well, I mean, really the rest of your life starts to turn upside down, right? I mean, it's such a fundamental part of being healthy is getting an adequate amount of sleep. Um, any thoughts on, I mean, you talked a little bit about eating, but any further thoughts on eating slash moving, or like, working out, are those aspects that make a difference? Because again, trying to figure out how people at home can start to get better habits. Because I know one of the things that we want to do is make healthier people, right? I mean, ultimately,
Sure.
we want our patients to be healthier. So, what things can they do to make themselves healthier, which will help their sleep, but help them in, I mean, in so many different ways, really.
Sure. Yeah. So I mean, I sort of think about the big three, and you've talked about those sort of. We talk a lot about diet and exercise, but we sometimes forget that something you spend a third of your life doing is sleeping. And so for me, those are the big three. When I'm talking to patients, I'm talking about all of those things, and I think they sort of feed into each other, right? So if someone's exercising regularly, there's a little bit of that sort of stress on the body, a healthy stress that sort of hopefully helps people to sleep better at night, right? When you're more active, you feel more tired. That can help people to get to sleep, and certainly for people that have insomnia where they can't sleep, exercise is a really important part of that. When it comes to healthy eating, I think it's the same thing, right? I mean, you're sort of how you treat your body is sort of going to allow you to reap the benefits of good health. And without getting into all the specifics, there's lots of different ways that people approach sort of healthy eating, but in general, whatever the system is, you're sort of putting that into your body for nutrition. That's going to allow you to function better, whether that's in exercise or in your work, and for sure, help you to sleep better. The flip side of that is that we know that it can be really hard to do the diet and exercise stuff, those really important behavioral interventions, when your sleep is poor, right? So when people don't sleep well, it's hard to be motivated. It's easy to become distracted. Decision making becomes not so strong, and people can sometimes have a really hard time, doing things that are a little bit more challenging. And so again, they all sort of come together, in my mind anyway, as sort of a triumvirate of good health.
Okay. No, that's great. I mean, I think this has been a lot of great information. So, anything you want to leave our listeners with in a bit of a summary in terms of how to just stay healthy and get better sleep? Any last bits of information that you want to leave?
Yeah. I think the biggest thing is for people to really pay attention to it, because it's the one that I think when we get busy in our lives, whether it's kids, work, other things, we start to sort of, burn the candle at both ends, right? So I'll stay a little later because I got to stay up a little later because I got to get some things done, and then get up a little earlier to get a good start to the day. But really, stepping back and saying, am I actually promoting my health by doing this, or am I actually, detracting from it? Because sleep, as I say, it's a third of our lives. It's a really important thing for us to have function properly, tissue healing, cognitive, neurocognition, cardiovascular, so many aspects of health that, if we're not paying attention to it, then those things can suffer, even when we think we're doing all these other things to help promote our health while we're awake.
Awesome. Well, that was great. I mean, I really appreciate it. Thank you for your time. I know this will be useful for a lot of people is, just figuring out again, sleep is such an important part. And I do think that we don't talk about it enough because it usually goes the weight side. It usually goes the eating and the exercising. But you said, three major factors and sleep being one of them. So thank you for your time.
Thank you. Appreciate the opportunity.